20-year-old Roney spends most days at home, keeping house for her uncle. Like many young women in the Mississippi Delta, she never finished high school and can't find a job.
Any trouble breathing or anything like that?
Okay. Sadly, Isha is like a growing number of her peers in another way. Last year, she tested positive for HIV.
And I just burst out crying. That was my first time hearing it, and I was shocked. I couldn't believe it. I was scared. I mean, I didn't understand how could I get it at a young age. How could somebody did not tell me what was going on with them?
Here, where cotton is still king and life for many is a hard scrabble fight for survival, the AIDS epidemic has taken deep root. Nationwide, women now account for a fourth of all newly diagnosed AIDS cases, double the percentage from 10 years ago. A disproportionate number of those women are poor, young, and African American.
Come on, talk to me here.
And this poses a particular dilemma for most African American churches.
We just can't be sanctimonious and church folks and not be involved. According to James, it's the leading cause of death in blacks of our young men and women between the age of 25 and 44. What are we doing?
Yet African American churches, a major force in the rural South, have been reluctant to address AIDS prevention, fearing it might undermine the church's traditional Bible-based teaching on extramarital sex.
We're teaching people against, against sex outside of marriage and fornication and adultery.
We don't want to encourage it in no way, form, or fashion at all.
Dr. Hamza Brimah, a Nigerian-born physician, is the only AIDS specialist for a 9-county area of the Delta.
We have some of the worst poverty in the United States of America. I've been on record as describing the Delta as being very similar to Africa in terms of the literacy, the education. We have some of the highest unemployment here in the Delta. It makes living really hard. There's really nothing to do here. So when young people get bored and have nothing to do and go out and have a few drinks, then what do you find next? Sadly, unprotected sex is the next thing that happens.
Dr. Brimah says that young women with few means of support will often enter into sexual relationships with older men in the hope of receiving even a small amount of financial help. He recalls what one female patient told him.
She said, "No honey, no money." The exchange of sex is often the only essential that, unfortunately, some younger women are left with in order to be able to obtain some money for, the daily essentials of living.
Isha, too, became involved with an older man, despite her mother's warnings.
My mama broke down to tears. She couldn't understand why. She couldn't understand the reason. She was always saying, didn't I tell you? Didn't I tell you? Why wouldn't you listen to me? Why wouldn't you listen to me? And I said, Mom, like you told me, you always learn the hard way. And that's what I did. I learned the hard way.
Because of misinformation about how HIV spreads and fear of getting it, Isha and others who contract the virus are often shunned, even by their own churches.
Anybody from the church come out to you, extended their hand to you?
Well, not extended their hand, but their prayer. So my church only one.
Many people feel that that is a subject that maybe ought to be left out of the church, left to the social community to get it out, when in fact it is one of our responsibilities as well. And because of the fact that this is AIDS Awareness Day weekend, I wanted to bring our attention to something that is relative.
While Reverend Lewis is willing to preach about AIDS from the pulpit, few churches are willing to go as far as this one in Nashville, Tennessee. A few years ago, Reverend Edwin Sanders decided to make AIDS prevention his congregation's main mission.
Truly, the cure to HIV and AIDS can be found simply in behavior.
Sanders Church has taken the bold step of handing out free condoms, both at the church and in the impoverished neighborhoods his church serves. Sanders says teaching sexual abstinence alone simply isn't working.
65% of all young people who are juniors in high school have had at least one sexual experience. Now you can sit here and believe that the 35% belongs to Metropolitan if you want to. All right? But the fact is, we do a disservice to ourselves and to our young if we're not honest about what's going on. God is saying we have to take action.
My son was Eric Clare Jordan. He died 2 days before his 30th birthday.
Judy Jordan, whose son died of AIDS, is a member of Sanders Church who passes out condoms in the community.
When we started taking on the different ministries of the church that had to deal with AIDS, I kind of jumped on the bandwagon. We still have in the African American community people that are afraid, people that still want to hold back, and it's not going to happen to me. And, well, I don't need that service. I'm not HIV positive.
In a more controversial move, Sanders Church also passes out free needles to prevent the spread of AIDS among intravenous drug users, a program Sanders refers to as harm reduction.
My name is Norma Coleman, and I'm 50 plus. I'm disabled. I have HIV.
Norma Colvin is someone Sanders Church helped get off drugs. She still recalls with anguish how many in her previous congregation rejected her because she is HIV positive.
It was like, they had touched the hot stove or something. They didn't want to hug no more,
But even some of Metropolitan's most active members question the church's decision to hand out needles.
I'm opposed to needles because I don't, clean, dirty, otherwise. Because I don't think that's the answer. I think the answer has to be found in Jesus Christ. And you pray to Him, He gives you strength to do anything.
How do you walk that fine line between giving out the condoms and the needles for serious health reasons and not encouraging further risky behavior?
Well, we talk about our harm reduction initiatives as a bridge to treatment. Obviously, you're never going to be effective at helping people to overcome the impact of addiction unless you somehow develop rapport. It can be that I simply meet you on the street and talk about sharing with you some tools that might help you to be safer and less vulnerable to sexually transmitted disease. If I can ever develop rapport with you on that level, then I might talk to you about how you begin to change your lifestyle.
If they won't be abstinent, then what else works? And therefore, if condoms will reduce the risk, condoms should be included in the messages that are given out to these individuals.
Many pastors say it is hard enough to talk about sex in many African American churches, let alone condoms.
Passing out condoms in the religious community, especially in the black, would seem to send the message, the wrong message.
It's important not just to talk about these issues in the context of the educational programs or these special forums. It's important for it to become a part of what happens on Sunday morning.
Despite growing attention from churches, HIV cases are piling up so fast in the South that help will have to come from outside the region.
I want to remain optimistic that in light of the bleak circumstances that we find ourselves living with here in the Delta, that maybe somebody will hear our cry.
Nobody
For Religion and Ethics News Weekly, I'm Judy Valente.